yeah, for sure, I'll probably have to be a lot more sensitive and gauge where they are, whether they're in a position where they may or they are thinking about quitting, or if they are more thinking about their lifespan and what they can get out of it in that short period of time they may or may not have left. Yeah, it's certainly a lot more. It'll be a lot more challenging.
When patients have a diagnosis of cancer, it's something that significantly impacts upon their life, both physically, psychologically as well. And I think we're in a good position. There are a lot of patients with a diagnosis of cancer, particularly if it's something that has a very, very good prognosis. And most patients are intelligent enough to know that smoking cessation will certainly improve outcomes, and that's when we need to strike while the iron's hot, and that's when we're in a good position to initiate change in that particular patient. So they're probably more so in the contemplative phase or the ready for action phase, and it does make it much easier when there is a significant diagnosis that affects their lifestyle and causes significant morbidity, for them to make some change, particularly with cancers whereby the diagnosis is early and the patient knows that they're in a good position to essentially prevent worsening or progression of the cancer by smoking, by ceasing smoking. And there's also the other benefits as well of smoking cessation, but I think primarily for a patient with a cancer diagnosis, it's what can I do to ensure that I don't contribute to the progression of this particular cancer.
It sort of changes the game a bit. I mean, we do way more kind of primary prevention for cancer. So you're always trying to stop the smoking before it's manifested any disease. So when you get to the point of having a diagnosis, it does change it a bit, because one, you can think, well, part of you might think, well, they got cancer now, why quit smoking? But the flip side of the coin is, well, the survival rates for a lot of cancers are a lot better now. So this can be an opportunity to say, well, look, smoking probably contributed, to your diagnosis. So, if we can get through this cancer, then, quitting smoking will probably improve your outcome with this current cancer, but also prevent you from getting another one later. So yeah, there's that flip side. And again, it's about reading the patient, because it's a big shock to their mental health getting the diagnosis. They might be putting on a brave face and a brave mask and things like that, but at some point, we're all mortal, and being confronted with your mortality is pretty hard. So I think you've got to just try and deal with the cancer diagnosis initially, and then the smoking is still very hard. Obviously, it's super addictive. So trying to take one step at a time. I mean, some people will quit cold turkey, and that's fantastic and supporting. But I think the more common role with someone like with a GP would be, okay, well, maybe this is the opportunity to just push them that next step forward in the process, and say, okay, well, these are the options to help you quit.
Like I mentioned earlier, I think any new diagnosis becomes a great opportunity to push the issue harder. Because often patients are perhaps they might be a little bit more motivated. Often they will be. Often they've thought about it. Often they've thought about the contribution of their habit to their new diagnosis, whether it's cancer, heart disease, diabetes, whatever it might be. And taking the opportunity to again ask the question and just mentioning to them, look, if as you're going through this cancer journey, if you can quit smoking, it will be of great benefit to you in the short term, but also in the long term. And just having those conversations repeatedly.